I am Dr. Rajesh, Associate Professor in Department of Plastic Surgery in Deccan Medical College. Also Consultant Plastic Surgeon in various hospitals in Hyderabad. Today we are going to discuss about one of the most common complaints which I come across in my daily routine practice. That is gynecomastia. Gynecomastia is a condition where non-cancerous growth of the male breasts. This condition is generally observed or seen in infants and adolescent age and old age. The condition is so common, like it's observed around 1 million population in India. In infants, the condition is mainly due to the abnormality in the hormones. Hormones in the sense the male hormones which are supposed to be increased and the female hormones which are supposed to be, there is an abnormal ratio or there is a change in the ratio of the hormones, then this condition is usually observed. From the mother's womb, from the placenta, that is, some of the hormones are injected or come to the child. So that's why we usually see there is a little swelling of the children's breasts. This is called a physiological. Physiological means which is normal. It occurs almost in most of the children. Like it's a common condition in the sense. Something which is not common is non-physiological. Something or an abnormality. The next physiological condition where you see is in adolescent age. Adolescent age where the children are developing the male secondary sexual characters. That time the hormones, the male hormones which are supposed to be increased, when they are not increased, and the female hormones which are supposed to get reduced, then that time when there is a change in the ratio, then again you will see gynecomastia usually around 10 or 11 or around 12 years of age. This will subside usually in 1 or 2 years of age. And the next condition is again in the later age, that is in the old age, where the testosterone hormones in the body comes down and the males, then again you may see these are physiological. Other causes in the adults are mostly with the drugs or chronic diseases associated with the liver or kidneys, like liver in the sense of chronic cirrhosis of the liver, also wherein the hormone which is supposed to get deleted is also one of the reasons wherein they develop gynecomastia. And in the chronic renal problems where they undergo a dialysis, also we can see all these kind of problems. And there are very rare conditions like in a Klinefelter syndrome, Peutz-Jeghers syndrome. There are some syndromes and some cancers are also associated with this condition, but there are extremely very rare conditions where you see gynecomastia associated. For them, the evaluation is different. How to manage this? There is no proven medical management for this. Like the drugs will not treat the cause. There are some drugs which are not even FDA approved, but there are some drugs where we can give, especially in the adult causes, but not for the physiological causes. Physiological causes, as I mentioned earlier, after certain time or age, they should subside and the body becomes normal like any other person. But if still it doesn't subside, then the options would be surgical. So we do a lipo, a small hole is made at the lateral side of the breast. Through that we suck out the fat. If there is any fat, we suck out the fat, and only the glandular tissue is delineated, and then through a small incision in the areola. Areola is nothing but that pigmented skin around the nipple. That is make a small incision. Through that we take out the gland. That is the most commonly followed treatment throughout the world, and it has a very great results. You can contact me directly in my clinic, that is Dr. Chandra's multi specialty clinic.